Okay, the nice thing about the Isolator tool is that it can isolate one head of the gastrocs. Now we can feel right to the tool. There's something that's probably a little bit tender there. Is that tender?
Yeah.
Yeah. And sometimes these two heads will actually get stuck to each other. And of course, this is great because you can actually bring that little prong in between them. If her hamstring is a little smaller, I can turn it at an angle like this and be able to cover that whole hamstring round, flat tip area. I could also use that one more precisely through this area, and some of them run down the shaft of the bone of the femur, the leg bone, and this, it cradles that bone really nicely. And now if I set this part of the tool right down, gather all of the trap away like this, and grab it here, I can now work that area. Can you feel that?
Mm-hmm.
Yeah, that's really effective. The trap is kind of pup tent shaped. In other words, there's a part coming this way, part coming this way. And those two areas will sometimes grow together. You now have something that's stabilizing that trap. Now again, if I was actually doing it, I'd have my palm of my hand on that ball, and I'm kind of going like this, and into there. A lot more effective than someone just working with their thumbs and fingers, perhaps.
Yes.
Yeah.
Much more specific.
But then, of course, I can get this trap really nicely. And again, if I turn the tool this way, if it's a little narrower muscle, now this tool will slide along the side of that neck. Okay, so you can work through there. I can do this whole lamina groove really precise. Right there, I feel a little speed bump. Then you can take the little tool and work right in between the spinous processes. There's little muscles, there's little ligaments, little tendons, and work them through. I could go up one, and I can feel right through the tool. There's the area right there. Now the really nice thing about this tool, one of the nice things is if you come across a muscle, because of the shape of the tool, it will just lift up and over. So I'm using the T-bar tool, and I'm using this flat edge, and going right along that root of the scapula. There's a little area deep underneath there where trigger points will hide and constantly reactivate. It will fit right in between the ribs beautifully. There you can see I'm right in there, but I will of course have both of my hands. You can use this on the side of the foot as well. You can use this all over this calcaneus. When we go over here along this side, you can see in the picture the muscle that runs right along there.
This, of course, is wonderful for the thigh and the forearms, and you can steady it with your other hand like this, and you can see the action that it has on the quadriceps or the hamstrings or the calf muscles.
My name is Merrill Lund, and I have been inventing therapy tools for 10 years now. Each tool is individually made by me in Naples, Florida. As the years went by, I could feel a real toll on my body, my thumbs and hands especially, while doing these therapies. I could see little on the market that made logical sense to assist me in my practice, nor were the tools designed logically to fit the human hand. It was out of necessity that I started to invent tools strictly to save my own hands. This has grown to where I now supply my tools globally from Australia to Austria.
Yeah, feels great.
Good. Now, the difference between your patient getting better and just getting relief is usually how precise and how thorough you are. So the more information you have, the more you know, and the more you learn to apply it to the person, you can get tremendous results.
You're right on that one.